Today we're demonstrating a Throwers 10 program. This is exercise 1, D2 extension with therotubing. James is demonstrating as you lift up and out, you rotate your thumb behind you. When you come down, your thumb comes towards your thigh. As you lift up and rotate, it's good to get a little bit of upper body rotation. In any kind of overhead athlete or throwing, there's always a little bit of rotation in the upper body. This can also be performed in half kneeling. Just make sure that the body is square in half kneeling. Same form, same exercise. This mimics a little bit more of a split stance for throwing. This is the same exercise, part 2. This is D2 flexion of the first of the 10 throwers program. So again, you're pulling from thumb behind you to thumb to thigh. You're getting rotation in between. Again, there's a little bit of trunk rotation that happens, and again, can also be performed in half kneeling. So drop to your knee, James. Right knee down. Oh, there you go. And same follow through. Again, the head is always looking at the arm and following the thumb. Thumb behind you, thumb to thigh. Great tips. This is exercise 2 of a Throwers 10 exercise program. This is the TheraBand internal rotation. Simply keep your elbow at your side and pull your hand into your belly, literally almost towards the belly button. Release on the out, but control the band. A common compensation is hiking in the shoulder. We want to make sure they don't do that and the shoulder stays down as you pull in and as you release. You can just simply turn around for the second phase of the same exercise. This is TheraBand external rotation. So it's pulling from your belly outward. It's not necessarily to go an extreme range of motion with this exercise. Keep tight tension on the band and limited range. Same compensation, we're watching to make sure the shoulder stays down and it doesn't hike up. This should fatigue quickly and wait for the burn. Exercise 3 of the Throwers 10 exercise program. Internal external rotation at 90. We want the elbow at 90 degrees, the shoulder up at 90 degrees. As you're pulling the band should be positioned just slightly below shoulder level. As you rotate up and rotate down, again, we want to watch for compensation and make sure the shoulder stays down and it does not hike up. This too can be performed in half kneeling. Just drop, James, to half kneel. Yep, in the same, we would have to lower the band in the same format. The second phase of this exercise is simply the opposite direction. Just swing around. Same thing, shoulder at 90, elbow at 90, pulling the band, controlling the release, making sure there's no hiking, and stand, James. And we adjust in standing, again, just below shoulder level. Watching for all the compensations and correct form. One thing to be careful of is that the arm never goes behind the plane of the body. Same idea, wait for the burn. Abduction of the shoulder, simply raising the arm or lateral raises to 90 degrees. We want to hold and pause for about a second or two when we get to the top. Same compensations we mentioned before. Do not let the shoulder hike. Make sure at the top the shoulder stays down and then lower. Slowly return. If you ever have shoulder symptoms, pain, discomfort, one way to start strengthening this motion with a little bit of an altered is to bend the elbows, stay at 90 and raise the elbow. This shortens the lever and gives you an advantage to strengthen stronger, quicker, and then can move and work to the longer lever. This is called Scaption. It's not directly at their side, but it is in the plane of their shoulder blade. Thumb will stay up, they'll stop at 90, and it's a little bit of a V. So turn this way, James, so we get a little bit better view. So this is the V, this, go to 90, this is 90, this is our Scaption, slightly in front and down. As they come up, same compensation, don't let the shoulder hike, keep it down. So it's seated depression. You need a bench or a table, a firm surface. You simply press down and lift your entire body up, shoulders stay down, and hold for several seconds before lowering and releasing. At least 2 to 3 second hold before you release. Try to build up the time that you can sustain it up to 10 seconds. Exercise 6 of a thrower's 10, push-ups. Before you begin, go on hands and knees. Set your shoulders by pulling them down towards your hips. Maintain that throughout your push-up. Toes up on toes. Keep your body aligned and do your work. Excellent form. Exercise 7 of the thrower's 10. Elbow flexion, bicep curls. Maintain the elbows slightly in front of the shoulder. Never let the elbow go behind the body. Keep the elbow slightly in front. Make the weight curl in an arc up and control the down. Sets of 10 is preferred. Again, don't let the shoulder rise. Phase 2 of exercise 6 is triceps. You'll often see it pictured in the program as an overhead press. We don't like it this way because of impingement problems that we see in overhead athletes. We prefer kickbacks, which is keeping the elbow at your side, bending over in a hinge. This stays aligned with the trunk. The shoulder stays up and back. Don't let it roll forward. Simply straighten your elbow and bend your elbow. Wait for the burn. There are 4 phases, all in a position we call prone, which is on your stomach. The first one is prone row. We're looking for engagement of the back lat and a pull squeeze. We're not looking for the elbow to just go higher than the body. This is wrong, this is right. A nice pull of the shoulder down and keeping that tension as the weight returns to the bottom. The following 3 phases will require a lighter weight than the row. So this we just call prone T's. You want your hand in line with your shoulder. Again, shoulder down, just coming out in a T motion. That's phase 2. Phase 3 is the same T with rotation. Just rotate your thumb up and then relax on the way down. Rotate your thumb up. Keep your thumb up the whole time and then release. Keep your thumb up the whole time and then release. Do you need a lighter weight, James? Phase 4 is coming up into external rotation and lifting. Same, we're looking for 90 degrees, and no hiking at the shoulder. Again, these are very challenging exercises. They should not get very heavy in weight. External rotation in sideline. We're looking for the elbow to be stabilized at your hip and on your body. We want to maintain your chest out and not a collapsed, rounded posture, but a nice chest lift. You want to try to lift till you get to a tabletop position of neutral and maybe a little bit higher, but again, we're not looking for extreme ranges of motion. So that's about our maximum height. We don't go way, 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 way up. So we keep it tight and slow. Exercise 10 of a thrower's 10 throwing program. Wrist extension, just maintain your forearm on any stable surface. Flip over for wrist flexion, phase 2. Let your weight curl all the way down and then lift up. And then holding the end of a barbell is the last phase, which is palm down, palm up. And again, just maintain stability of your forearm on the table, usually 2 sets of 10 of every exercise.